Shin pain is a common complaint that can affect people of all ages and activity levels. It can range from mild discomfort to sharp, intense pain and may be caused by a variety of factors. If you're worried about pain in your shins, it's important to understand what might be causing it, how to treat it, and when to seek professional help. Shin pain is often linked to overuse injuries, particularly in those who participate in running, jumping, or other high-impact activities. One of the most common causes is shin splints, also known as medial tibial stress syndrome. Shin splints occur when the muscles, tendons, and bone tissue around the shin become inflamed due to repetitive stress. This condition is particularly common among runners, dancers, and military recruits. It typically starts as a dull ache along the inner edge of the shin bone and can worsen over time if left untreated. Shin splints can be caused by several factors, including sudden increases in physical activity, improper footwear, running on hard surfaces, or having flat feet or high arches. When the muscles and tendons are overworked, tiny tears can develop, leading to inflammation and pain. If you've recently started a new exercise routine or increased the intensity of your workouts, shin splints could be the culprit behind your shin pain. Another potential cause of shin pain is a stress fracture. Unlike a full bone break, a stress fracture is a small crack in the bone that develops over time due to repetitive force. Stress fractures in the shin bone, tibia, are often seen in athletes who engage in high-impact sports or long-distance running. The pain from a stress fracture is usually sharp and localized to a specific spot on the bone. It tends to worsen with activity and improve with rest. If left untreated, a stress fracture can worsen, leading to more severe injury. Compartment syndrome is another condition that can cause shin pain. It occurs when pressure builds up within the muscles, cutting off blood flow and oxygen to the affected area. This condition can be acute, often caused by trauma, or chronic, typically seen in athletes. Chronic compartment syndrome usually causes a tight, cramping pain in the shins that starts during exercise and subsides with rest. Acute compartment syndrome, however, is a medical emergency and requires immediate attention, as it can lead to permanent muscle damage. Less commonly, shin pain can be related to underlying medical conditions such as peripheral artery disease, PAD, which causes narrowed blood vessels and reduced blood flow to the legs. PAD can lead to cramping and pain in the legs, including the shins, particularly during physical activity. Other potential causes of shin pain include muscle strains, tendinitis, or even nerve irritation. If you're experiencing shin pain, there are several steps you can take at home to alleviate discomfort and promote healing. Rest is crucial, especially if the pain is caused by overuse or a repetitive strain injury. Avoiding high-impact activities that exacerbate the pain can help prevent further injury. Applying ice to the affected area for 15 to 20 minutes at a time can reduce inflammation and numb the pain. Be sure to wrap the ice pack in a cloth to protect your skin from frostbite. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help reduce pain and inflammation. Additionally, elevating the affected leg and wearing compression socks or bandages can help reduce swelling. Stretching and strengthening exercises for the calves and shins may also aid in recovery by improving flexibility and reducing muscle tension. If your shin pain doesn't improve with rest and home care, or if it becomes more severe, it's important to seek medical advice. A healthcare professional can assess your condition and recommend appropriate treatment. They may order imaging tests such as X-rays or MRIs to rule out more serious issues like stress fractures or compartment syndrome. Depending on the cause of your shin pain, treatment options may include physical therapy, orthotics, or even surgery in severe cases. Preventing shin pain involves taking steps to reduce the risk of injury. Gradually increasing the intensity and duration of your workouts can help your body adapt to new physical demands without overloading your muscles and bones. Wearing proper footwear that provides adequate support and cushioning is also essential, especially for those who engage in high-impact sports or activities. Replacing worn-out shoes regularly can help prevent issues related to improper foot mechanics. Incorporating cross-training activities, such as swimming or cycling, can reduce the strain on your shins by giving them a break from repetitive impact. Strengthening the muscles in your legs, particularly the calves and shins, can improve your overall biomechanics and reduce the risk of injury. Stretching before and after exercise is another key factor in preventing shin pain, as it helps maintain flexibility and reduces muscle tension. For those who have flat feet or high arches, using custom orthotics or arch supports can help distribute pressure more evenly across the foot and reduce the strain on the shins. Additionally, Paying attention to your running form and avoiding hard surfaces such as concrete can make a big difference in reducing shin pain. It's also important to listen to your body. Pushing through pain can often lead to more serious injuries, so if you notice discomfort in your shins, it's a good idea to take a break and assess what might be causing it. Resting and recovering properly can prevent minor issues from becoming chronic problems that require more intensive treatment. In some cases, shin pain may be a sign of a more serious condition that requires medical intervention. If you experience severe pain, swelling, or numbness in your shins, or if you have difficulty walking, it's important to seek medical attention right away. These symptoms could indicate a stress fracture, compartment syndrome, or another condition that needs prompt treatment. For those who participate in sports or activities that put a lot of stress on the legs, working with a coach or trainer to improve your technique and form can help reduce the risk of shin pain. Proper warm-up and cool-down routines are essential, as is gradually building up your endurance and strength. Paying attention to your body's signals and taking breaks when needed can prevent overuse injuries and keep you active and healthy. Overall, shin pain is a common issue that can result from a variety of causes, most of which are related to overuse or repetitive strain. While it can be uncomfortable and frustrating, most cases of shin pain can be treated effectively with rest, ice, and proper care. By taking preventive measures and addressing the pain early, you can reduce your risk of developing more serious conditions and enjoy a healthy, active lifestyle. If shin pain persists despite your best efforts, consulting a healthcare provider is the next step. They can provide a more accurate diagnosis and suggest additional treatment options to help you recover and get back to your activities without pain.